Hi, welcome to today's episode of the Heart Matters podcast. I'm Caitlin Quinn, the lead dietitian at Boston Heart Diagnostics, and I'm here today with Dr. Michael Dansinger. He is a nationally recognized expert in dietary and lifestyle coaching for weight loss and related medical problems. He's the medical director for Boston Heart Lifestyle Program, the founding director of the Diabetes Reversal Program at Tufts Medical Center in Boston, and is the nutrition, diabetes, and obesity expert for WebMD. He's previously served as the nutrition and obesity editor for WebMD's peer-reviewed academic journal and was the principal investigator of the Tufts Popular Diet Trial, comparing the Atkins Zone, Weight Watchers, and Ornish eating plans for weight loss and heart disease risk factor reduction. He currently serves on the U.S. News and World Report's Best Diets judging panel and on the Council of Directors for the True Health Initiative. He's also served on the Center for Disease Control expert panel for worksite wellness programs and was the nutrition doctor for NBC's The Biggest Loser for 10 years. So welcome, Dr. Dansinger.
Well, I'm so glad to be here. Thank you, Caitlin.
Can you tell us, please, why you practice lifestyle medicine and your role at Boston Heart?
Sure. So I'm a doctor, and I'm especially interested in the leading causes of medical problems throughout the United States and the world. The leading causes are heart disease and obesity and diabetes and related conditions. They're the ones that are causing so much suffering and cost to the healthcare system. And after practicing primary care for several years, I decided I wanted to focus my energies and efforts during the past 20 years on finding ways to help patients and other clinicians on improving lifestyle diseases. So I've been with Boston Heart Diagnostics for 8 years now in my role as the medical director for the lifestyle program, and I've been fortunate to be able to work with a team to help create the Boston Heart Lifestyle Program and to help bring it to patients and other clinicians.
Great. And what is the Boston Heart Lifestyle Program?
Well, I like to think of it as a transformation method for individuals who are looking to better themselves. So the Boston Heart Lifestyle Program is for clinicians to use as a tool in their practice to help their patients. And the lifestyle program includes a personalized lifestyle prescription called the Life Plan and coaching. And I like to think of it as scientific ultra-personalization. It's a special method that we use in order to give a highly specific, highly tailored plan to each patient that's based on the science.
Great. And why was it important for Boston Heart Diagnostics to have a lifestyle program?
Well, clinicians, our clients, love helping patients to transform and improve their health. And it's challenging to do that in clinical practice. And so by popular demand, Boston Heart wanted to respond to the needs of the clinicians who are interested in a company that doesn't just unmask hidden risk of heart disease, which in itself is very important, but to be an important part of the solution for how to reverse abnormalities that are seen in the blood tests. A lot of doctors and other clinicians know that lifestyle is the key to addressing the underlying causes of these conditions, heart disease, diabetes, obesity, etc. And they love the lifestyle program because it allows them to do a better job in their clinical practice. And they also like the Boston Heart Lifestyle Program in particular because they recognize that the personalization approach that we take is very helpful for getting the patient's buy-in, to boost the adherence and compliance to making lifestyle change, because it's better than a one-size-fits-all approach.
And who are the people that benefit most from this program?
Well, anyone has the opportunity to better themselves, and we're all on a journey to improve ourselves. But the ones who benefit most are the ones who have hidden risk factors that respond to lifestyle changes, risk factors that are the underlying, that are the effects of lifestyle-related conditions. The risk factors for cardiovascular disease, diabetes, obesity are all responsive to lifestyle changes. And so those who have the most to gain from lifestyle changes are the ones who benefit most. But most importantly is it's for people who are willing to own it and take responsibility for their health. And it's hard to be your own police. And there are people who benefit from getting assistance from their doctors, healthcare provider, and from coaches. And so those who are open to making changes and having assistance with the changes they want to make are also ones who benefit the most. There are people who've had serious medical problems that they want to reverse. Heart attacks, diabetes. Some people are ready for insulin shots. Some people have a substantial amount of weight they're looking to lose. And all of those patients have the potential to make dramatic transformations with their lifestyle program.
Great. And you mentioned that the life plan is personalized to the patient. How is that?
So that's a great question. So the method that we use includes the sophisticated advanced testing that help uncover hidden risk factors, but also a questionnaire that allows us to better understand important aspects of the individual that aren't revealed in the blood testing. We want to know the patient's food preferences, foods that they like and dislike. We want to know their exercise habits and their preferences. We want to know if they're interested in losing weight. And we gain information about them through the questionnaire. It takes about 3 minutes for the questionnaire to be completed, either online in the patient portal or at the time of blood draw. And then we use the information from the questionnaire and the blood test to create a personalized nutrition prescription that includes their protein, fat, and carbohydrate recommendations, their calorie recommendations. We provide food lists that are compatible with their nutrition prescription, menus, recipes, and exercise recommendations that are all personalized to the individual. No two life plans are the same because no two people are the same. So we're very proud of our personalization method.
That's great. And when you think about the future of the lifestyle program, what are you most excited about?
So I'm very excited about the opportunity to help more people. So far, we've helped 60,000 individuals who've had a life plan, and I'm looking to reach 100,000 as soon as we can. And so, knowing that there are many, many people out there who could benefit from the lifestyle program is an exciting opportunity for us. I'm excited by more interaction with leading organizations, lifestyle-focused organizations like the American College of Lifestyle Medicine and the True Health Initiative, who are leading the charge to make a difference on the national level. I'm interested in tracking dietary intake and improvements in dietary intake, and we're looking at partnerships that will allow us to more quickly assess dietary intake and changes in dietary intake. And then I'm always interested in innovating new tests to demonstrate health improvements of dietary improvements. So we already have leading tests that allow us to see the improvements that occur from dietary and lifestyle changes, but there's room for ongoing innovation there.
Wow, that sounds really exciting. And tell me a little bit more about the Boston Heart lifestyle coaches.
So we have spectacular coaches, as you well know, Caitlin, because you lead the group. So we have about a dozen coaches throughout the United States, and they are all highly skilled dietitians who are engaging and able to interact with patients to inspire them and educate them and provide structure and accountability. They can review the life plan with the patient and establish a coaching relationship. Patients can purchase coaching sessions for less than the cost of a copayment to a healthcare provider. And so they can provide further customization and help the patient understand the value of logging their food. The combination of food logging plus the coaching, which provides the oversight and the inspiration to make lifestyle changes, that combination of the logging plus the coaching, I think, is the magic equation that fuels transformation. It's hard to transform on your own, but with the help of a coach and by measuring improvements in dietary intake, anything is possible. So I love our coaching program, and I would recommend participating in coaching to anyone who gets a life plan. So there are many great things in store for the Boston Heart Lifestyle Program. I'm proud of the improvements that we've been able to help patients achieve in the past years, and it's just a great opportunity for me as a doctor to work with such a great company and so many great clients and patients.
It's definitely an exciting program, and thank you so much for your support and for your dedication to changing people's lives. And thank you for being here with us today.
Thank you, Caitlin.